worse yet, since the aim was to study untreated syphilis, when penicillin became available in the 1940s, recall this study started in 1933. So in the 1940s, early 1940s, penicillin became available, and it became clear that penicillin was effective in treating syphilis at any of the 4 stages of syphilis. There was a nurse who was assigned to keep these men in a cohort and keep them untreated, and she would actually pull them out of clinic lines if they had even tried to get penicillin, because people were beginning to know that penicillin was effective. So this experiment was not ended until 1973, when a newspaper reporter wrote a critical article and revealed this to the general public. Today, I think Tuskegee serves as a metaphor for unethical research, for the ultimate failure of informed consent. And it's one of the primary reasons why African Americans are reluctant to consent to participate in clinical trials. It's very difficult to build trust after trust is lost.
Right.
Well, almost immediately after the revelation of Tuskegee's study, the federal government took several actions. First, it was a Senate investigation that was headed by Senator Edward Kennedy. He's still there. He served as the chairman of the investigating committee. Then a national commission for the protection of human subjects was set up. And in 1978, this group authored a report that now provides the philosophical underpinnings for the current federal laws of human subjects in the U.S. This report is called the Belmont Report. It's called the Belmont Report because the men and women who gathered there to write the report wrote it at the Belmont Conference Center. Well, the Belmont Report established 3 fundamental ethical principles. First was respect for persons, or autonomy, and it acknowledges autonomy. Certain populations, such as prisoners, children, and live human fetuses, because of their potential vulnerability, are provided with additional protections. Beneficence requires that we maximize the anticipated benefits and minimize the potential harms and risks. Research risks must always be justified by the expected benefits of the research. Justice is the third principle, and it requires that we treat all subjects fairly and equitably. All must share in both the potential risks as well as the benefits of the research, and particular groups, especially the vulnerable, like those who might be in a prison or those who might be in a nursing home or a mental institution, cannot be selected out. And the vulnerable must always be protected. Well, getting closer now to our present age, in 1981, the federal regulations that apply to all research supported by the federal government were promulgated. These are the regulations that are in place right now. They oversee all of the research that is supported by the federal government. But keep in mind, there are many research projects that are funded by pharmaceutical companies or foundations that are private. And in fact, they don't really fall under the federal regulations, but it's been our tradition to keep all experiments that are done in the U.S. under the federal regulations, Title 45 of this code. Okay. Now, I've mentioned lots of protections, so, we kind of think we've been learning a lot, we know a lot. Nothing could ever happen bad anymore, but in fact, it's sad to say, we do see experiments that are happening. This was from 1996, where Native American children on an Indian reservation were given an experimental vaccine, and their parents were never told, never asked for informed consent, and of course the children never knew that they were taking part of an unproven experiment, taking part of a drug that was unproven. Well, I'm going to tell you now about a good case. And This case is extraordinarily dramatic, and it emphasizes both the courage of the research participant to face the unknown and the striving of clinical investigators to challenge the unknown in their effort, again, to always push the envelope to develop new knowledge that will help those in need. Now, many of you may know about Parkinson's disease or even know somebody who has Parkinson's disease. It's very common, affects more than 1 million people, and it's characterized by loss of cells that release a neurotransmitter called dopamine that's released deep in the brain in a region called the striatum. And the loss of dopamine somehow imbalances brain circuits that are necessary for smooth movements. So you probably have seen the 3 cardinal symptoms of Parkinson's disease. One is a tremor. Michael J. Fox, has a big tremor in his hands and his head. Another is kind of a rigidity in the limbs. And most disturbing is an inability to initiate movements, which is known as bradykinesia. Many of you may have noticed kind of a mask-like face that people with Parkinson's have because they really don't have control over their facial muscles. So one of the great advances in modern medicine was the discovery of L-DOPA, or Sinemet. And this can actually restore the normal dopamine levels and really help people with Parkinson's disease. But eventually, the helpful effects of Sinemet wear off after maybe 5 years or 10 years, and they're left again with these devastating symptoms. So here's a novel therapy, and hopefully one of you will be able to figure out why it works. You insert an electrode deep in the brain to stimulate a small group of cells. You can help prevent the symptoms of Parkinson's disease. Now this electrode must be very, very perfectly placed to make sure that it works in the right place. This is what the electrode looks like. So these black bands are where the electrode is. And there's a stimulating wire that leads from the electrode out of the brain and under the skin of the neck out to a transmitter right at the base of the chest underneath the clavicle. And it's similar to the placement of a cardiac pacemaker. So here is the electrode that is placed in the brain. And now I want to tell you about the courage of a woman who was willing to take the risk when it was very experimental to have an electrode placed in her brain. We're not talking about a drug, we're talking about a wire that's placed in a brain. And the results were not really known. So I'm going to show you the movie of a woman called Sybil. I actually met her, a very, very heroic woman, and I'm hoping this works.